Without further ado, I'd like to introduce to you my CEO, Sheila Schweitzer. She is the founder of PatientMatters, a company focused on assisting healthcare organizations in the management of the patient obligation. Prior to PatientMatters, Ms. Schweitzer was CEO and chairman of the board for CareMedic. Under her leadership, CareMedic achieved a lead position in the HCIT revenue cycle market, where they successfully brought to market the first enterprise-class revenue management system, the Electronic Financial Record, or EFR. Ms. Sheila, are you ready to take it away?
I am to introduce Rick Sevigny. Rick Sevigny is our VP of Human Resources. And so since we're talking about the small employer and how a hospital should interact with their employer's constituents, I've asked Rick to sit in.
Great, welcome, Rick.
Okay, this session.
Thank you, Betsy.
This session is all about why and how a community hospital should host small employer meetings. As we all know, that open enrollment begins here in a few days. Even though we are into our second year of the Affordable Care Act, this year is somewhat different than last year, mainly around the small employer and the small employer's obligations. And the reason we work with our partner hospitals to really help them host small employer meetings is for a couple of reasons. Okay, we believe that community hospitals, we know that community hospitals, they have a significant presence in their communities. Very often they're the large employer, and obviously they're the supplier of quality health care. But in these communities, we find that very often there's an abundance of small employers. And those small employees receive care at the community hospital. So we strongly encourage our partner hospitals to, be good citizens, help educate the population, as well as treat the population. And we've seen great success and benefit when our hospitals begin an outreach program to the small employer. The ACA, even though we're in our second year, it's still very confusing. This year, because of the extension of the ACA, is really the first time that small employers could begin to feel the implications or the impacts of the regulations. And coupled with that, hospitals in a community could also begin to feel implications around the small employer, mainly from a perception viewpoint, but we believe that communication and education is really important, particularly for small employers. So that's why we're encouraging our partner hospitals to hold these meetings. Okay, how do we do that? We've developed a small employer training or education program in just a few slides. But what we do is we actually train the hospital executives, even though hospital executives certainly understand the ACA market. When we say we train, we really have this consolidated program that we give to them, and then we help the executives to understand really how to deliver this message. We encourage our partner hospitals to partner with the community advocates, people like the United Way, churches, the Navigator program, if there is a Navigator program in their organization, Chambers of Commerce, Rotary, perhaps very often align with an insurance broker that you're aware of and that has the patient's focus at the point. The whole premise behind this is small employers are going to be affected in this enrollment period, and we want our partner hospitals or any hospital to take a leadership position in the community. That's why we encourage our hospital partners to hold these sessions. Okay, this is the beginning of the actual program or presentation or educational session that we give to our hospitals. And for those of you who are on the website, on this webinar, this program will be on our website, and feel free to download it, use it if you find it has value, or if you need discussion or want to talk about it, or at the end of this you'll have my contact information. You can contact either myself or Rick, and we'll help you through it. But it's a program we designed for community hospitals, and we're making it available via our website to anyone who would like to use it. I'm not going to go through this on the slide-by-slide basis. I really want to walk you through the components and why we put each piece of this educational program together. So feel free to stop me at any time. But we've put this together so that we could really take education, get the small employers to understand the impact and what the possibilities for the benefits and the implications of the Affordable Care Act to them. We talk about large employers in this training session, but we use large employers as just a contrasting between the small employer requirements versus the large employer requirements. This is not geared to the large employer. We're going to talk about really the 4 constituents that are affected by the ACA, and that's the insurance carriers, the individuals, of course, the employers. We're focusing on the small employers, and the providers. So that's what this program has been created to do. Insurance carriers, there's restrictions on insurance carriers of plans that they can offer pre and post the ACA. These are widely known benefit structures. I think most of you on the call understand before and after to an insurance carrier. However, I would like to point out one thing this year. In this new open enrollment, insurance carriers have the option to offer ACA structured plans, not through an exchange. The same structure, the same benefits, the same costs, the same everything. The only difference being is if they offer it not on the exchange, then any individual who was eligible or who is eligible for a subsidy is no longer eligible if they buy it on a non-exchange means. That's a little tricky. We're seeing a lot of the major insurance companies do that. So it's important that an individual and these small employers understand the nuance of where you buy the exact same plan. That's new this year. It's really the only change that we see between last year's enrollment and this year's enrollment. So unless anybody has any questions, that's really all I'm going to talk about regarding insurance carriers and their portion of the ACA. Let's talk about individuals. Okay. Very little has changed for the individual under the ACA from the open enrollment last year to this year, with the exception that there's automatic rollover for an individual who was eligible for Medicaid last year. They automatically enroll or auto-enroll this year, assuming nothing changed in their tax reporting. So that's a new feature. We have not seen that any of the insurance companies are doing auto-enrollment. So we're still waiting to see if that's a possibility. Other than that, the individual regulations remain the same. Okay, the employers. This is really what this session is all about, because as everybody knows, President Obama extended the requirements to small employers so that last year they did not have to comply. This year they must comply. So that's why another reason for us to really work with partner hospitals to get the message out to these small employers. Now, it's still a little ambiguous who's a small employer and who isn't. And the reason for that is the regulation says that if you're 100 employees or less, you're a small employer. However, every state has the opportunity to change that. Most states have defined the small employer as 50 employees or less. However, there are still some rules that apply if you're a 50 employer or if you're a 100-person employer. So for small employers, it can get very, very confusing. Okay, let's talk about what must an employer do. Okay, the first thing the small employer must do is they must notify current employees and they must notify all new hires. And they have to do it in a very compressed time frame. You have to do it within 14 days of an employee's start date. So all of these regulations have virtually kicked in as of October 1st of this year. Okay, so there's some issues around the summary and the benefits of coverage. I think all of us in the industry really understand this. So, we've tried to be very concise, very crystallized, so that a small employer really begins to understand the impact. This one is a little tricky, and that's the notice of the plan change. This is one of those things that we encourage time spent on with a small employer, because they can only do this one time, and it really means that they have the opportunity to restructure their benefit programs and change their plan dates. Now, the reason that particularly your small employers might look at doing that is for cost benefits and tax benefits. Okay, so this is one that when we work with the executives of our hospitals, we spend a fair amount of time on. Okay. We all know about the waiting periods, really a good thing of the ACA because it means individuals can become covered sometimes 90 to 120 days than they used to be able to. The Medicare tax, I think we've all felt that one already. Penalties. The penalties on large employers is pretty onerous. But there's an option out there for small employers called SHOP. And SHOP is an option where small employers can, in essence, buy their benefit structures with a community pooling rating, which is highly, highly beneficial to a small employer. You have to be a small employer, and you have to have designation from your state as a small employer. But a highly beneficial opportunity for the small employer to continue to offer their employees benefits. Okay, there are penalties if the employer does not offer the appropriate levels. But one of the reasons it's so important for the hospitals to reach out to the small employers in their communities, if a hospital chooses to be very active in enrolling individuals into the health exchanges. Okay, so let's say a hospital helps an employee obtain coverage on the exchange, and that employee's employer did not adhere to the regulations. Because that employee enrolled and obtained insurance, that triggers a penalty to the small employer. Okay, not only for that employee, but for every employee over 30. So from employee 31 to employee 50, that hospital could have been perceived as triggering a penalty to that small employer. This is really something that's really hard to understand, but a really important item that both the hospital, if they choose to be very aggressive in enrolling people, which is the thing that we recommend our hospitals do, you also then should be aware that you have attempted to educate the employers in your market. So this is a really important piece. Of course, W-2 reporting, everybody knows that. We've talked about auto-enrollment. So without doing a session on the Affordable Care Act, this is why we have chosen to put this program together to be a resource to our hospitals, to help them with education, training, the highlights of the Affordable Care Act, and why we think it's important in small communities. So with that, I'll open it up for questions. Betsy, do you have any questions?
I am looking at the question field right now. We're going to give people a couple of minutes to type something in, but as of right now, we don't have a question. Sheila, I was wondering if you could go over,
Okay.
You talked about the 501R the last time I was in the meeting, and I think it'd be beneficial for these employers' meetings that these community hospitals know about 501R too. Can you just tell us a little bit about that?
Certainly. 501R is a new Internal Revenue Service regulation for not-for-profit hospitals. And what this regulation states is a hospital must choose a discounting policy or must choose a pricing policy for all of their self-pay business. And they have, there's 3 ways that they can calculate the pricing. One is use Medicare's pricing across the board. 2, they can take an average of their managed care contracts for pricing. Or 3, they can take their top 3 managed care contracts plus their Medicare reimbursement to come up with the average. So that's the pricing structure that can be used, and they have to choose one and then declare. Now, within certain departments of a hospital, there can be different pricing. An emergency room can have different pricing from an inpatient to an outpatient. But there are very strict guidelines that the hospital must do to notify the patient of the financial assistance policies in place in their hospital. They have to be published and displayed inside the hospital. Every time there's a communication with a patient, they have to be given written communications detailing the financial assistance policy, and it has to be available in the patient's native language. Then every time a billing goes out to the patient, the statement has to contain the financial assistance policy. It has to contain a phone number, a web page plus the link of where they can go online and find the assistance policy. There's also timelines around it. The patient, within the first 90 days, if they ask for financial assistance, or they say, I believe I'm eligible for financial assistance, they get an additional 120 days to determine if they are or are not eligible. So now they are, excuse me, it's 150 days. So now they are at 240 days. If at 239 days they say, I believe I now am eligible for financial assistance, they get another 240 days before the hospital can begin to take collection efforts. So that's new, not really part of the Affordable Care Act, but it is a new regulations that hospitals had to begin to comply with starting in June of this year. That was a very long answer to one question, Betsy. I'm sorry.
No, that's okay. I just found that to be really interesting the other day when you talked about it, and since we do have community hospitals on, I thought it would be beneficial for them to hear that, and to also know that we do have the webinar from Lyman on our website as well if they'd like to go out there and listen to his information about the 501R and things that they must do. The next question that I'm just going to put out there for you and also for Rick, you guys have done a few of these out in community hospitals. What were some of the questions that you had, you know, from employers or the community hospitals when you've presented this before?
It was interesting. The small employers, not surprising, they really didn't understand everything that was required of them. They did not understand a lot of questions around what would trigger a penalty. Am I really a small employer? A lot of questions around what an affordable health plan is. And it's interesting that what the definition of an affordable health plan is, it cannot be greater than 9.5% of the employee's total salary. So if the premium ends up being 9.5%, or let's say 9.6% of their total salary, then the employer has to do one of two things. They either have to raise the employee's salary, or they have to compensate the employee the dollars above 9.5%. That's probably the number one surprise we found, that employers just didn't appreciate. One, they had to calculate it. Two, they should know it, and what they had to do to cure that.
Okay, I'm looking and I still don't have any questions from the panel. Let me give them one more option. Is there anybody that would like to, wait, I've got one coming in. Hold on. Okay. How actively involved can or should a hospital be in helping employers educate their employees on available plans during the open enrollment period? Suggestions you've seen successful?
You know, we see it on a hospital-by-hospital basis. It's really a choice of the hospital as to how active or not they want to be in enrolling people into the exchanges. I will tell you, we track this closely. In between last year, when we saw hospitals very aggressive, getting certified application, getting their staff certified to become certified application counselors, some hospitals even obtaining navigator status. So we saw it very active last year. In the hospitals we work with, what really occurred was they could not see the financial benefit to the hospital against the cost and effort of being very aggressive in these programs. So what we're seeing nationwide is that hospitals are choosing not to be as aggressive in the enrollment process this year as they were last year.
Okay. Looks like we don't have any additional questions. Is there anything else that you'd like to add, or?
Well, I would just like to add to, if you feel like that the program has value for you or any of your constituents, please go to the website and make use of it. There is no cost. It's a program we put together, and if you think it has value, please go get it and visit our website. Other than that, I thank you very much for attending.
Thanks, everyone, and have a great day. We appreciate you attending our webinar. Bye-bye.